if we detached a heart from all its external connections and a hormonal connection, it continues beating. Yes, that is the peculiarity of heart. It has its own mechanism that helps to beat without any support, without any help, and without anyone's concern. Today I am going to explain the electrical connection of heart. Before going to the main topic, I just going to explain the cardiac cycle, because that cycle is truly or totally managed by this internal connection of electrical impulse. Is a section of heart. You can see upper two chamber, right atrium, left atrium, left ventricle, right ventricle. It has two main artery. Is a pulmonary artery, that is aorta. 4 valve, bicuspid valve, tricuspid valve, and 2 semilunar valve, aortic valve and pulmonary valve. There is 2 main vein drains into right atrium, a superior vena cava, inferior vena cava, and that represents 4 pulmonary artery. That is base of heart and that is apex of heart. That is musculature of heart. That is musculature of atrium. That is musculature of ventricle, much more thicker. That is interventricular septum. That is musculature of right atrium, right ventricle. That is musculature of right atrium. Okay, that is valvular plane. Okay, valvular plane is more or less in a same line or same plane, more or less. Now, in cardiac cycle, atria contract, and blood goes to ventricle from left atrium to left ventricle and right atrium to right ventricle. Then ventricular contraction starts. That's way, and blood ejected through aorta to whole body and through pulmonary artery to pulmonary bed. That is a cardiac cycle. Cardiac cycle is extremely controlled by internal cardiac electrical mechanism or internal cardiac electrical circuit. Our today's concern is heart's internal electrical circuit. This well organized contraction, relaxation or heartbeat, cardiac systole, diastole is everything controlled in a good way or in a beautiful way by a master gland that is called SA node. That is node SA node. SA node is situated in the right atrium, just near the opening of superior vena cava. This SA node is not any nerve fiber. It is a specialized cardiac muscle. There have been a very confusion regarding this. Many students understood misly. That is not. You have to remember, you have to understand and remember that that is not any that is nerve cell, that is truly modified cardiac muscle cell which have electrical activity and not it has contractile activity. Okay. The SA node, if we separate SA node from all its external connection, SA node can generate impulse about 90 to 100 times per minute, just like this, just like this, just like this. Action potential is always generated into SA node. That's why it is called the pacemaker of heart. It has power to generate action potential automatically. It need not helps from any other nervous connection or hormonal influence. Basically, nervous connection or hormonal connection can influence its automaticity, but its automaticity has a special type. It can generate impulse 90 to 100 times per minute. Okay. Then we have another node that is just near atrioventricular septum. Okay. It has also automaticity, but its automaticity is lesser than this master node. This node is called AV node or atrioventricular node. That is SA node, sinoatrial node, that is AV node, atrioventricular node. SA node generates cardiac contraction and it has connection with AV node. The opinion of most of the physiologists or researchers have it has mainly three connection. That is posterior connection, that is middle connection, that is anterior connection, as some fiber goes to left atrium to contract left atrium. When SA node start producing impulse, another thing just I want to say, that fiber, internodal fiber, 3 in number, they are also specialized cardiac muscle, not nerve. They are also specialized cardiac muscle, not nerve. You must have to remember, because in their various examination the question is asked, this fiber is whether nerve fiber, muscle fiber or any other thing. That's why you must have to remember that all is specialized cardiac muscle that have power of conduction but not contraction or relaxation. Okay. When SA node start generating impulse goes through this way, this way, this way, this way, and in a quick manner atria start contracting. When atria contract, blood from atria pass through this valve, tricuspid or bicuspid valve, and it enters into left ventricle and right ventricle. Okay, this is in a precise way is controlled by SA node, the contraction of atrium, and it is very important to generate cardiac cycle also. Another thing you should have to remember that this plane is very important, because this plane has valve, 4 valves, and this is demarcation line between ventricle and atrium. And another thing, electrical current cannot pass through this, and through this, because of this plane. This plane is a fibrous plane, collagen fiber. This makes atrial ring. This ring is totally insulative of current. That's why cardiac impulse cannot pass through this ring beyond this line. Okay, so that is AV node. AV node can produce about 60 beats per minute at its own, and if we disconnect from its AC AV node, this node can generate 50 to 60 beats per minute, and it's manage a heart rate at this rate. This node is called collecting node because it collects impulse from SA node through various fiber. It collects. Okay. After collecting impulse or current, it pass down the cardiac muscle or ventricular muscle. When it pass down the ventricle muscle, ventricles start contracting. Okay, if we see ventricle is starting contracting from upper portion, thus like this, it is not possible to flow blood through artery and vein. On the other way, if it starts from below, from apex, this way, blood can easily eject through aorta and pulmonary artery. That's why it is very much needed to start contraction from below upward. Here we have just one connection to pass electricity or current from atria to ventricle. Okay, this connection is made by a fiber, a thick fiber called atrioventricular fiber of His. The guys invented the fiber, that's why it is called His fiber. From collecting node or AV node, electric pass through this atrioventricular bundle. This bundle is also a modified cardiac tissue, not nerve cell or nerve fiber. Okay, then we have a right branch, left branch of these two. there is some fiber like this, some fiber like this. Okay. So this is atrioventricular bundle of his. Here electric pulse through left branch of atrioventricular bundle, left branch of atrioventricular bundle, and through right branch of atrioventricular bundle. Through this bundle is called left and right branch of AV bundle. Okay, so we have this two, through this two bundle there is branches here, 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 here. It comes up to apex, and through this bundle electric is conducted very quickly, because electric have to reach first at the apex. Okay, from the apex we have so small bundles which goes throughout ventricular muscle, that called Purkinje fiber. Purkinje fiber. Okay, now we have the major element of cardiac electrical conduction system. Number 1, SA node. Number 2, AV node. Number 3, atrioventricular bundle of his. Number 4, left and right branch of AV bundle, and lastly Purkinje fiber. Okay, total 5 element. Now electrical current produced in SA node, it pass via internodal connection, via internodal connecting fiber, and then in the AV node impulse delays. Why impulse delays? Because of before contracting ventricle, atrial contraction must have to be completed, otherwise blood will not fill the ventricle properly. Okay, before contracting ventricle, atria should be contracted first. That's why the AV nodal delay is occurred. It delays electrical impulse near about 40 millisecond. this 40 millisecond is crucial for ventricular filling. Atria contracts, then we have 40 millisecond time for ventricular filling. After ventricular filling, ventricle start contracting and blood ejected via aorta and pulmonary artery to whole body and pulmonary bed. This 40 millisecond is very vital. Here is Purkinje fiber through SA node, AV node, atrioventricular node, right and left branch of atrioventricular bundle, and the Purkinje fiber, it stimulated and heart contract like this way from bottom to upward. It push blood to upward to eject from aorta and pulmonary artery. Okay, that is one cardiac cycle. Earlier said that there is a ring in this plane. That ring prevent electrical impulse to go downwards. Without AV bundle, atrioventricular bundle, it is not possible to go downwards to apex of the heart or rest of the muscle of the heart, and it is not possible to contract muscle up at ventricle. So that is the only connection, only electrical connection between atrium and ventricle. This is also a vital important point. You should remember this. Okay, that is all about cardiac electric circuit. One interesting thing, earlier I have said that if we separate heart from its all external connection or external influence, it beats 90 to 100 times in a minute. So the SA node can generate 90 to 100 beats per minute. Then why our pulse rate is 70 to 80 per minute? That's important. Yeah, I'm going to explain all this. Our heart have neuronal connection, that is parasympathetic nerve, 10th nerve, vagus nerve, the largest parasympathetic nerve of the body, and parasympathetic stimulation lowers heart rate because it can inhibit SA node as well as AV node. It has power to inhibit SA nodal impulse generation and AV nodal impulse generation. That's why the normal tone is maintained by vagus nerve, and our heart rate never goes above 100 per minute. Normally 70 to 80 per minute. That is because of this inhibition of this vagus nerve. Vagus nerve is inhibitory to SA node and AV node. If we cut vagus nerve here, then cardiac impulse or heartbeat will go above 90 to 100. That's why in a recipient percent whose cardiac implantation occurred, that percent heart rate is always above 100 or something like this. Okay. We have another nervous system called sympathetic nervous system. Sympathetic nervous system has also innervation to SA node and AV node. sympathetic nervous system always try to increase heart rate. It has effect on SA node as well as AV node. It always try to increase heart rate. That's why when or panic attack occurs, that time due to sympathetic overactivity, our heart rate goes above 100, 110, 112 and like this. That is the reason sympathetic nervous system in our body, when we have a panic attack or anxiety or any other state like this, our sympathetic nervous system gets upper handed and it's produce much more stimulation to SA node and AV node, and that's why heart rate goes beyond 100 and palpitation starts. Okay, that's two. There is another influential hormone, that is adrenaline and noradrenaline, and that also influence on our heart. Okay, that's all about nervous system and electrical system of a heart associated with nervous connection.